Hello, gentlemen. Dr. Alan Rivera here. I want you to picture a moment. It's not the moment of passion, but the one that comes just after. The world is quiet. You're lying next to the woman you love, the woman you've built a life with. And in that silence, a question drifts into your mind. A question you've probably never said out loud. Maybe something unexpected happened. A release from her body that you weren't taught about. It wasn't in the movies you grew up with, and it certainly wasn't discussed at the dinner table. And in that quiet moment, you wondered, what was that? Is that normal? Is she okay? Maybe you felt a flash of confusion or even concern. You're a man who knows how to fix things. Engines, leaky faucets, business deals. But this is different. This is human. And if you've ever felt that flicker of uncertainty, I want you to hear me clearly. You are not alone. That question doesn't make you ignorant. It makes you a caring partner. Act 1. The silence and misinformation we inherited. For too long, men of our generation have been handed a broken map when it comes to female pleasure. We were given myths, locker room jokes, and a culture of silence. We were taught that intimacy was a simple, linear path, a performance with a predictable ending. But the truth, the beautiful, complex, human truth, is far more fascinating. Today, we're going to replace that broken map with a reliable compass. We're going to talk about something that the internet often gets wrong, that late-night talk shows joke about, but that very few explain with the respect it deserves. We're going to discuss the phenomena often called squirting and female ejaculation. I know, even saying the words can feel a bit awkward, but knowledge replaces awkwardness with confidence. And the facts I'm about to share aren't just interesting trivia. They are the keys to unlocking a level of trust and connection with your partner that you may not have thought was possible at this stage of your life. So stay with me. The silence ends today. Act 2. The real science your father never knew. Let's get straight to the point. The biggest source of confusion comes from one fundamental mistake: lumping two completely different biological events under one umbrella. The terms female ejaculation and squirting are not the same thing. Let's clarify this with real science, but in a way that's easy to understand. Think of it like this. One is like a concentrated, potent espresso shot, and the other is like a surprising, warm wave of water. Both are natural, but they come from different places and are made of different things. Fact number 1. Female ejaculation, the espresso shot, versus squirting, the wave. First, let's talk about female ejaculation. Inside a woman's body, surrounding the urethra, are a set of glands called the Skene glands. For decades, scientists have referred to these as the female prostate, and for good reason. They are structurally and functionally similar to the male prostate. During intense, deep arousal, these glands can produce and release a small amount of a thick, milky white fluid. We're talking about a teaspoon or two, not a large volume. Scientists have analyzed this fluid and found that it contains prostate-specific antigen, PSA, the same protein found in male semen. This is not urine. This is a unique fluid created for pleasure. This is the espresso shot, concentrated and distinct. Now let's talk about squirting. This is the phenomenon you're more likely to have seen sensationalized. This involves a much larger volume of fluid, sometimes a cup or more, that is released in a gush or a wave. Extensive research has confirmed that this fluid is in fact a diluted form of urine released from the bladder during orgasm. It's often clear and odorless because the body has been processing a lot of water. So let me be perfectly clear. Female ejaculation, a small amount of a distinct PSA-rich fluid from the skin glands. Squirting, a large volume of diluted urine from the bladder. A woman might experience one, the other, both, or neither, and all of those possibilities are 100% normal. It is not a goal to be achieved or a sign of success. It is simply a possible expression of her unique body. Fact number 2. Why your response is the most powerful tool you have. Now we come to the part that truly matters. Knowing the science is one thing, but what you do with that knowledge is everything. Whether it's a small, milky release or a larger gush of fluid, your partner's first thought in that vulnerable moment is often, what is he thinking? Is he grossed out? Is this a mess? Am I embarrassing? Your reaction in the seconds that follow can either build a fortress of trust or create a crack in your foundation of intimacy. Recoiling, making a joke about the mess, or jumping up to grab a towel as if it's an emergency sends a message of shame. It says, this part of you is a problem. But leaning in, holding her close, and whispering something as simple as, you are incredible, or thank you for sharing that with me, sends a profound message of acceptance. It says, all of you is welcome here. The messy, the unpredictable, the beautiful, all of it. This isn't about whether you should or shouldn't swallow the fluid. While it's generally considered safe between healthy, monogamous partners, that's a personal choice. The real point is the emotional response. Your acceptance is the ultimate aphrodisiac. It builds a safety that no pill or technique could ever create. Act 3. A patient's story. When misunderstanding creates a rift. I remember a patient of mine, let's call him Henry, a wonderful man, a retired architect from Philadelphia, 68 years old. He was a man of precision and order. For years, he and his wife had a loving, if somewhat predictable, sex life. One night, his wife experienced a large gush of fluid for the first time, what we now know as squirting. Henry, being the problem solver he was, reacted with clinical concern. He asked if she was okay, if her bladder was weak, if they should see a doctor about incontinence. He thought he was being caring, but what his wife heard was, you are broken. There is something wrong with you. She didn't say anything, but over the next few months, Henry told me she grew distant. She'd turn away from him at night, making excuses. The joyful intimacy they once shared had been replaced by a quiet, sterile space. Henry's misunderstanding, born from a lack of knowledge, had unintentionally shamed the person he loved most. He came to me thinking there was a problem with her, when the real issue was his reaction. Act 4. The solution. Turning confusion into deeper connection. Henry's story has a hopeful ending. Our work together wasn't about learning new sexual techniques. It was about learning a new language, the language of reassurance. I coached him to do something that felt very vulnerable. The next time they were together, he brought it up first in a quiet, non-sexual moment. He said, I've been thinking about what happened a few months ago. I've done some reading, and I realize now that it was a beautiful sign of your pleasure, and my reaction was clumsy. I'm sorry if I made you feel judged. I want you to feel completely free with me. He told me his wife cried, not from sadness, but from relief. The wall between them crumbled in that single moment of honest, humble communication. The solution for you is the same. It's not about making it happen. It's about creating the emotional safety for it to unfold naturally. It's about replacing fear with curiosity and judgment with admiration. It is the single most powerful thing you can do to revitalize your intimate connection. Fact number 3. The uncomfortable truth about sex and heart health after 60. Now, I must be the doctor in the room and address something critically important. Many channels or articles will tell you that more sex automatically leads to better health, lower blood pressure, and a stronger heart. For younger men, there's some truth to that. But for us, for men over 60, the science is more complex and demands our respect. A major study published in the Journal of Health and Social Behavior found something that might surprise you. For older men, frequent sexual activity, once a week or more, was actually associated with a higher risk of cardiovascular events, like heart attacks. Now, I am not telling you to stop having sex. I am telling you to be wise. Intimacy is a vital part of a full life, but it cannot be seen as a replacement for sound medical care. It is a powerful activity, and if you have any underlying conditions, high blood pressure, heart disease, diabetes, your sexual health must be part of an ongoing conversation with your primary physician. We must move beyond the simplistic idea that more is always better and embrace a more mature, holistic view of our health. Act 5. Your new identity, from performer to partner. For decades, we were conditioned to see ourselves as performers in the bedroom. Our value was tied to our stamina, our erection, our ability to deliver. I am here today to offer you a new identity, a more powerful one. You are not a performer. You are a partner. You are a guardian of the connection, a steward of trust. Your role is not to create fireworks. Your role is to create safety. Your strength isn't just in your body, it's in your presence. It's in your ability to look at your partner in her most raw, unguarded moment of release and see not a mess, but a masterpiece. It's to make her feel beautiful, not in spite of it, but because of it. When you embrace this role, the pressure to perform vanishes. It's replaced by the pleasure of connecting. You are not broken. You are not getting old. You are graduating to a more profound, more meaningful form of intimacy, one that values emotional courage over physical mechanics. This is the great gift of aging with wisdom. Your homework is not to study a chart or practice a technique. It is much simpler and far more powerful. Find a quiet moment with your partner in the coming days. Take her hand, look her in the eye, and ask a brave question. Something like, what's one thing I could do to make you feel completely safe and cherished when we're together? Then just listen. Don't defend, don't explain, just receive her answer as the precious gift it is. That one conversation can change everything. Please see every video we share here as a conversation to open up new directions. Your health is a personal journey, and the most important co-pilot on that journey is your own doctor. Always consult with them before making any changes to ensure you're making the best choices for your specific situation. If you believe in this mission of providing trustworthy, evidence-based health information for older adults, please subscribe to ElderCare Insights and turn on notifications so you won't miss our future videos. And if you found value in this honest talk today, please share it with a friend or loved one. You never know who might be struggling in silence.